Hello, welcome to WCC Wednesday. We are here with another COVID update. We've been joined by Geoff, who is one of our advisors, and Dan, who's one of our WCC staff, to talk a little bit about where we are with Omicron and COVID and all the things. So I'm going to hand it over to you, Dan, to get us rolling.
To be clear, I'm going to ask some questions and make Geoff do most of the talking here, since he is the expert. Geoff, can you tell us where we're at with the Omicron wave and sort of the trajectory that you see in the next month or two?
Yep, happy to do that. So I think if you look at the graphic on the Wisconsin Department of Health Services website, or any other of the measures around the country, pretty much the whole country, and including Wisconsin, is really seeing a very sharp decline now, and has for the last couple of weeks in cases of COVID, which are almost all Omicron right now. Wisconsin peaked just about 2.5 weeks ago on about the 19th of January. On average that day, we were having 15,500 new confirmed cases per day, which is almost, which is certainly a significant underestimate of the actual number of cases, because many people don't get tested because they either have mild symptoms or no symptoms, or nowadays some people are getting tested at home and those numbers aren't getting added in either. So the real peak was way higher than that, but it was probably around the 19th of January. Now here we are. As of 2 days ago, which is the most recent that the website shows, we were down to 3,142 cases per day. That's a significant drop. But I do want to say that you have to distinguish between the really great looking trajectory, which is really good looking, and the actual number, which is still not good looking. 3,100 cases per day is still a lot of virus. And it's going to very likely to continue to go down, but right now we're not at a low level yet.
Yeah, I think I saw yesterday that we're at about 64 cases per 100,000, and the WCC cutoff for the Nogo limit is 50 cases per 100,000. So we're still quite a bit above where we'd like that to be.
Yeah, that's right, Dan, absolutely. The WCC cutoff of 50 new cases per 100,000 per day would translate to about 2,900 cases per day statewide. So we're not there yet for sure. And by the way, that's still a lot of COVID.
Right. But do you think that we might get there by the end of the month if we're lucky?
Well, I do. I think it's very likely that we're going to get under that 50 new cases per 100,000 per day, which translates to an average of 2,900 cases statewide per day. That's likely to happen within the next week, I would think. But the next category that I would highlight in the WCC returning to church benchmarks is the one that says unsafe to gather without mitigations. And that benchmark is 10 cases per 100,000 per day, which translates to about 580 cases per day statewide on average. And that could be a while before we get to. I hope we get to it by the end of the month, but it could easily be into a little bit into March. We'll just have to wait and see, but it'll be a few weeks, but on the current trajectory, I think we're going to get there.
Right. And the next stage down, the safer, might take even longer. And if I understood what you were telling me yesterday, getting down to the safest level, it could be an indefinite amount of time before we get to that level.
Yeah, that's right. Well, safer is, safer, and again, these benchmarks I think are excellent in the WCC's returning to church document. Safer is 5 cases per 100,000 per day, or somewhere between 5 and 10. 5 per day is the actual number in the state would be about 290 or 300 new cases per day. That could be a while, but we might see that by the end of March. I'm hopeful. I am optimistic about that. Safest, that's down to 1 per 100,000 per day, and that's only, basically 58 cases per day in the state overall. That could be a while. But I think, that gets into sort of some of the questions I imagine you want to start talking about. It's like, what's the practical implication of all this? Because WCC advised its members to, switch back over to all virtual and avoid in person during the peak of this Omicron. And I think the practical questions are likely to center around, okay, so are we still there?
Yeah. So here's the $64,000 question. Should churches go back to in-person worship now?
So my advice is not now, because we're still definitely clearly above the unsafe to gather mark. And there's a lot of COVID out there, even though the trend is really good. We just aren't there yet. So then when? I personally, I really like these benchmarks, and if churches could wait until we were below the 10 per 100,000 per day, which would be about 580 cases per day statewide, I think that would be wise. And that could happen before the end of this month or early into March. So, just kind of watching the trend. Because right now, COVID is dropping like a rock, but it won't keep doing, it's going to start to slow down, right? And so when does it get under that 580 or 600 per day level? We'll just have to watch and see. But honestly, the thing to keep in mind is because it's dropping exponentially. And that means that every week you can just hold off another week buys you a lot more gain in terms of safety. When it starts getting flat, in a month from now, then every week you wait is not buying you a lot more in safety. But right now, just a few more weeks of waiting would really make a difference, especially for folks who are unvaccinated or folks who are vaccinated but vulnerable. People who are over 65, people who are under 65 but have chronic illnesses that you might not know about, these kinds of things.
Yeah, people may have heard about the BA2 variant on Omicron that's going around, which is even more transmissible. Or
amazingly.
Yeah, right. You didn't think it was possible. However, it doesn't seem to be more severe than the Omicron that we're familiar with. I think the one thing to note about that is that might goof up that downward slide. If that takes hold, right, then we may sort of plateau earlier at a higher level.
That's right. That's right. It may make that tail a little longer and a little flatter. But we'll just have to see. I do think that the other nice thing about your WCC benchmarks is that once you get under the 10 per 100,000 per day or 580 actual cases statewide on average per day, then what the guidance that you've already put out, that I think is really wise, suggests that then it would be okay to consider coming back in person with mitigations, right? So that means the basics that we continue to talk about. It means encouraging people to wear masks, or if you want to require it, that's up to you. It means making it possible for people to physically distance themselves, at least if they're from different households. And it means having some availability of hand sanitizer and that sort of thing. Some of this is going to be a matter of individual risk tolerance, and especially if we start getting, in the couple hundred cases per day statewide, then it's really hard for me to come out and say you must do this or you must do that. I think that becomes much more of a judgment call. As just right now, today, we're still just too high. But in a few weeks or a month, we're going to be in this place where I think some people are going to be like, okay, come on back. we're not going to make any recommendations about masking or distancing. Other people are going to be like, okay, come on back, but really please wear a mask and really please keep your distance until we get down below that, really safest level of under 50 or 60 cases per day.
I think what we're hearing from most of our member churches is that they do require masks, and thank you folks for doing that. Keep up the good work. And think about seeing if you can get everyone in the congregation to wear an N95 or a KN95. They're not terribly expensive. You can, most churches I think could afford to buy a bunch of them and hand them out on Sunday morning. Remind people to sit 6 feet apart. Get back to that sanitizer, sort of go back to all those rules, like you say, because it doesn't make a difference what the variant is. How you handle that's going to be the same.
Yeah, I agree with that, Dan, and I just want to emphasize that in most cases it doesn't matter what the variant is, but for masking and the high quality masks that you're talking about, the N95s and the KN95s, the variant does matter, and Omicron being so much more infectious, like that really has highlighted how important these high quality masks are, whereas with Delta or the Alpha or the original, it made less of a difference, but Omicron, having a KN95 or an N95 is really extra good and makes a big difference.
Yeah, folks, cloth masks, single layered cloth masks don't do very much against Omicron. So make sure you're getting surgical masks or those N95s out there. Breanna, I think you had a question.
Yeah, sorry, I was like distracted. There's some yelling happening behind me. You never know what happens when you're on the square. I guess I was curious about, we think we hear all about vaccination. The WCC has a vaccination project. We're talking about it a lot. And where does vaccination play into all of this? We've been talking about precautions, but what does that affect things?
Right, and so the WCC's benchmarks also include some guidance around vaccination rates. Unfortunately, statewide, we're not that good right now. We only have, last time I checked, which was yesterday, we have just under 60% of the state on average is fully vaccinated. That's not including boosters, that's just regular fully vaccinated. And that's not nearly good enough. And even our best county, which is Dane County, is at 77%, which looks good relative to the rest of the state. Although Menominee County is good and Kewaunee County is good, they're on the 70s also. But that's not really to the point where you can say, all right, vaccination rates are high enough that we can factor that into our thinking around starting to gather in person, or maybe not encouraging masks or that sort of thing. You'd really want to see that up around 90%. And I don't know when we're going to get there. But every little bit helps. Every person that gets the vaccine that wasn't vaccinated before is one more person who's better protected. Every person who gets a booster that wasn't boosted before is one more person protected. And so I think we do need to keep really encouraging people, meeting them where they're at, trying to understand their concerns. I mean, the vast majority of people who haven't gotten vaccinated or boosted yet are not, they're not, they have legitimate questions, right? They care about their own health and their family's health. And so, or they're even just struggling to figure out, because I'm working in my, I'm living in a rural area, there's no place that's convenient for me. So meeting people where they're at, and it's not a fast process at this point, but I think it's still an important one.
Very good. Yeah, and if you would like your congregation to serve as a vaccination clinic, everybody, you let me know. Dan Schultz at wichurches.org, and I will hook you up.
Yeah, I think just the power of having safe spaces for people to come and bring those questions of their church. Like for us, it's churches, and creating that space to have a conversation, because that's where we're at. And judgment and shame doesn't get people anywhere. It's this, how do we be compassionate and welcoming and loving? Sounds kind of like Jesus. I don't know. Maybe.
It may have something to do with that.
Well, I want to say thank you both for joining us today. We will continue at the WCC having these conversations. I'll drop a little plug. We are doing a upcoming conversation circle for church leaders. And I forgot, I think it's February 23rd. I will drop,
right.
I will drop it in the comments as a place for people to come, bring your questions, bring conversation. What's working in your congregation? Where are you struggling? And it's a space for us to kind of have a conversation as a group. We're trying to create, sometimes we talk at you like this. Sometimes we create space for you guys to have conversation. So I'll drop the sign up for that in the comments. Thank you both so much for this conversation.
Thank you. Good to be here.